Hello, I'm Keegan. I'm the pharmacist. What can I help you with today?
Hey there. I'm having some nasal and head congestion, and I talked to my doctor, and he told me to get some of this Afrin, and I never used it before, and I just need to know like how to use it. What's it gonna do?
Yeah, of course. So, the one I recommend is the one you're holding, the Afrin 0.05%. It's an intranasal spray, so you'll just spray it in each nostril. Then it also goes by the name oxymetazoline. That's just the generic name. The intended use for it, it's just for nasal decongestion. So if you have like a cold or hay fever or just, I guess just a runny nose or congestion, you can use it for that. It'll work fine.
Okay.
After you do use it, which I'll go over how to use that, um, it should work within 10 minutes after the spray, so pretty quick onset. The dose you want to take, you'll put 2 to 3 sprays in each nostril twice a day as needed. You don't want to go over 2 doses in 24 hours, or it can cause, it's something called rhinitis medicamentosa, which essentially just means a rebound effect. So your nose will feel even more congested than it does right now,
Okay.
which we don't want. A way to mitigate that, you just want to limit this to a 3 to 5 day period max. If you are still experiencing any congestion, we can always try something else, or you may want to contact your doctor.
Okay.
So as for using it, you do have to prime this, which just means you'll take it out of its container and you'll just want to point it in the air away from you, and you'll just spray until a full dose sprays into the air.
Okay.
And then when you do administer it in your nose, you do want to be in an upright position and sort of lean over so that there's just like a straight path up your nostril when you do spray it.
Okay.
As for things to look out for, you'll want to call your primary care provider if you do have any nose irritation, sneezing, burning, or just like increased stuffiness after using it. If you do happen to miss a dose, and it's been at least 12 hours and it's still far away from your next dose, you can go ahead and take it. But if it's still a ways out or pretty close, you'll just want to wait until that scheduled next dose.
Okay.
By chance, do you take any other drugs or
I do
anything?
not.
Okay. There aren't any major drug interactions with regular everyday things. With caffeine, though, it does provide an additive effect as a CNS stimulant, which basically just means you may feel slightly more wired if you do have it with caffeine. So you may just want to stay away from caffeine while you are taking this. You'll want to go ahead and store it in just room temperature in a dry area away from pets and children. And do you have any questions for me at all?
Not that I know of, but you said to only use it for 3 to 5 days.
That's correct. You'll want to stop use after that, and then just contact your doctor, or we can try you on a different medication to try to help that.
Okay.
It was a bunch of information. Would you mind just repeating back the important points to me so I can make sure you retained it?
Yes. So you said you have to prime it first when you first open it. So do I have to do that every time or just the first time?
It'll just be the first time after you open the product, and then every spray after that, you can just go straight into your nose.
Gotcha. So then once you prime it, it's 2 to 3 sprays in each nostril twice a day.
That's correct. Yeah.
And then, like you said, 3 to 5 days of use. And I think that's it.
Yep. What other questions do you have for me, if at all?
None that I can think of.
All right, perfect. Well, I hope this works for you.
All right, thanks.